After 10 years of providing therapy for anxiety, I totally get why people tell me that their anxiety treatment with other people isn't working. And that is especially true if you think anxiety treatment is all about learning coping skills or deep breathing exercises. If that is what you are looking for, I am not that kind of therapist. You officially have my permission to skip this video. But before you do, let me offer this. I've worked with people with anxiety disorders for over a decade, and if there's one thing I know for sure that does not work, it's collecting more tools for the toolbox. My name is Oliver, and I'm a licensed marriage and family therapist here in Los Angeles, and my approach to anxiety treatment is a little bit different. Here's what we're going to cover in this video. Number one, why your ever-growing toolkit of coping strategies may actually be making your anxiety worse. Number two, the root cause of anxiety disorders that 90% of therapists completely miss. And number three, why the only way to truly treat anxiety is to stop playing defense and start going on the offensive. Because you can't win a game you're not even trying to play. If you're in therapy for anxiety and you're feeling stuck, or if you've been told therapy is just all about talking about your childhood, let me show you how I help my clients change their relationship with anxiety and how much of a game changer that can be. Let's start with this first of all though. Anxiety is more than just a feeling. When you really examine it and break it down like I've done over the course of my career, you find that it's actually a complex, misunderstood, self-reinforcing experience that affects almost every part of your life. If you're slightly on board with this idea, then the bad news is that no single tool or trick is ever going to fix it. And let me explain why. At the core of every anxiety disorder is an intolerance of uncertainty. Even people without anxiety don't love uncertainty, but for those of us with anxiety, it feels unbearable. It's not just uncomfortable, it's something we have to eliminate, avoid, or control at all costs. So if your anxiety shows up as constant worry, it's always about the what ifs. What if this happens? What if I fall apart? What if I can't handle it? That is all about the uncertainty or fear of what is going to happen or what might happen. If you have social anxiety, your anxiety comes from not knowing how people will respond to you, not knowing whether they like you or if they are judging you or if you're making a fool of yourself. Not knowing is uncertainty. Relationship anxiety, well, that's uncertainty about how secure your connection is. Are they going to leave you? Do they love you? Are they texting someone else? Are they okay? Health anxiety, same pattern, it's just focused on the body. What does that ache mean? Is it serious? Could it be something life-threatening? It's all uncertainty, but related to health. Uncertainty is the common thread in all anxiety disorders, but it's the fuel, not necessarily the whole picture, not necessarily the whole car or the whole engine. Every anxiety disorder has different rules of engagement, which are thought patterns and processes built around it that we follow without even knowing it. And this is where most therapists miss the mark, because we're not just dealing with a feeling, we're not just dealing with an aversion to uncertainty, we're also dealing with a set of constructs that alter our thought processes. And the way that I envision them is like an invisible set of rules that anxiety's taught us and demands that we follow. And the more we follow them, the stronger the rules become. I call them the 10 rules of anxiety, which sounds a bit hokey, I know, but I swear I use these almost every session with every client, regardless of whether they came in to get help with anxiety or not. That is how universal these patterns are. So to help people remember the purpose of these rules, I often talk about the 3 S's of anxiety. The goal of anxiety is to keep you small, safe, and separate. Almost everything anxiety tells you to do, avoid things, ruminate on things, hide things, control things, is in service of this goal. It wants to keep you small so you don't take risks, safe so you don't get hurt, and separate so you don't get exposed or rejected. That may have helped us thousands of years ago when the threats were saber-toothed tigers or starving over the winter, but today, those patterns keep us stuck, disconnected, and exhausted. So let me give you a few examples so this becomes a bit more concrete. If you are a worrier, you might relate to the worry is the solution paradox. It's a rule that insists that you worry all the time because anxiety has tricked you into believing that worrying is the same as problem solving, and in actual fact, they could not be further apart. Worry is the first part of coming up with solutions. Worry activates a very cognitive, very conversational part of your brain. Problem solving is more creative, it's more visual, it fires up different parts of our brain. and the two don't operate at the same time. Anxiety tricks us into thinking it's the whole deal, and if you listen to it, your problems don't get solved, and your brain throws up more and more what-if, worst-case scenarios for you to think about and remain stuck on at 3 o'clock in the morning. If you've got social anxiety, you might get into the idea of the comparison contract. It's a rule or one of these thought patterns anxiety has programmed us and tricked us into believing that makes us look for how well other people are doing. And there's nothing wrong with that inherently, but for people with anxiety, the script will quickly flip. Instead of being inspired or motivated by the success of other people, our anxiety sneakily finds a way to make us insecure about our own lack of competence or success in comparison to other people. So it does a really good job of making us feel smaller in some ways. And when everyone else is bigger, better, fitter, faster, or smarter than you, that inevitably makes social situations really challenging. Again, anxiety is keeping you small, safe, and separate. If you followed along with me so far, you can probably see where I'm going with this. A treatment approach that only focuses on coping skills, breathing techniques, or distraction strategies doesn't even begin to touch the real architecture of anxiety. Now, don't get me wrong, coping tools have their place. When your heart is racing or your palms are sweating, deep breathing or grounding techniques can help regulate your nervous system in the moment. Perfect. But they don't challenge the rules, and they certainly don't shift your relationship with uncertainty. Tools alone aren't enough to dismantle the pattern that keeps us locked in anxious cycles. So that is why I do things very differently. I work with a lot of high achievers here in LA, people in entertainment, tech, finance. They have high functioning anxiety and are able to lead teams, manage multi-million-dollar budgets, and build companies, but they are still derailed by anxiety attacks, insomnia and worrying, or obsessive intrusive thoughts, and random health concerns. And that is because they are still following anxiety's rules without even knowing it. They are checking their phone 50 times to see if someone replied. They avoid situations that might make them foolish. They ask for reassurance over and over, even though they know the answer. They've learned to cope with anxiety, but not to change it. And that's one of the first things that I explain is when we rely too heavily on our coping tools, we accidentally reinforce the idea that anxiety is something that we cannot face head on. The over-reliance on tools and techniques gives anxiety even more power because we're saying that it's something that must be avoided, soothed, or tiptoed around. But in truth, that just makes it stronger. The over-reliance on coping skills and tools is a bit like treating a sore throat with ice cream. Feels good in the moment, but it's not doing anything to get at the underlying infection. And eventually the symptoms just come back, and often even worse. So we need to go deeper. I think my approach to treating anxiety is fundamentally different. I'm not really interested in helping people manage anxiety symptoms. I want to help people change their relationship with it. So instead of trying to get rid of anxious feelings or anxious thoughts, I want to help people respond to them differently. I want to help people challenge the rules that they've been following, to test their assumptions and to stop letting anxiety dictate the game. And when people start doing that, the results can be really fast. I've seen clients make really dramatic progress in a few weeks, not months. And that happens when they stop playing defense and start actively engaging with their anxiety in a new way. You cannot win a game by only playing defense. You have to go on the offensive sometimes. And that is the mindset that I really want my clients to adopt. When you stop listening to the rules of anxiety, when you stop staying small, staying safe, and staying separate, you begin to change the whole system. And anxiety backs off because it really doesn't know what to do with your rebellion. If you are tired of managing anxiety and ready to actually shift it, here's what you can do next. The first one is you can take my 10 rules of anxiety quiz. It's totally free and it will show you which of anxiety's rules are most active in your life, and you get a free email course from me explaining a bit more about them. Secondly, if you're ready for real change, schedule what I call the anxiety audit. It's a 45-minute clinical consultation plus a battery of anxiety assessments that help us map out how anxiety is impacting you, what areas you need to focus on, and what you need to change. My approach to anxiety therapy is to stop playing by anxiety's rules. Take the quiz, book the audit, change the game. And it is a game that you can win if you play by your own rules, not anxieties. The links are all below. Hit follow and subscribe if you want more.